Hello, my name's Jim Ariola, and I am working with AMAR, that's the Association for Retirement Communities in Mexico. I'm an advisor on their health policy. Additionally, I also have a healthcare information company that I work with in California, and we've been involved for many years with cross-border healthcare and lately with medical tourism, where people from one place go to another place for their medical care or their dental care. And over the last few years, because of the high cost of health care, a lot of Americans have been going overseas to the Far East as well as to Mexico for their health care. With AMAR, we focus on senior care and living, and assisted living is obviously one of the areas that we're focused in on. Most recently, the AMAR staff has been contacted by many of its members as well as website visitors wanting to know more about medical travel to Mexico. The last few months, AMAR has been looking for an arrangement where we could team up with professionals who are experts in that area. And who we have here now is Tina Jenkins with Premium Medical Services, who happens to be one of the experts in this area. And this interview is meant to educate viewers on medical care in Mexico, as well as talk about AMAR's new patient advocate service. Hi Tina, how are you?
Fine, thank you, Jim.
We're here in your office, and thank you so much for allowing us to talk to you.
Absolutely.
Great. But right off, if I looked at your resume and your history, and it's very impressive, can you tell viewers a little bit about your clinical background?
Certainly. I have been a healthcare provider for 20 plus years. I have worked not only in the operating room, but as one of the head nurses right in the trenches, but I have been also a member of the board of quality control for different hospitals. And so I've been able to oversee many different aspects in healthcare and how it's played out in the United States and in Mexico. So I have a comparison of the both.
In Mexico too?
In Mexico too, yes.
Fascinating. Can you kind of describe a little bit about your experiences working in Mexico as a nurse?
Certainly. I chose to work independently versus directly for a hospital. So I've always been on a part of a team, surgical team. So I've been able to travel to different hospitals to be able to see different way they handle different procedures and their ethics. And in doing that, it has enlightened me to many different things that they should or should not do, in my opinion. So it's helped me to assist, be it a family member to a friend that is in need of health care, that they cannot afford nor is available for them. I can help guide them. And so what I've found myself is, instead of my niche, I guess I should say, in nursing, I've kind of pulled out of the clinical aspect of it and have focused more on helping patients get the proper treatments that they need and understand what's available out there for them that they do not know. That's where I have now turned into be more of a patient advocate. I'm no longer working, so I'm a retired nurse, but I still have many years of experience that I want to share and help patients. So that's why I have put together a great team here in the United States and able to assist people from abroad. A lot of Canadians, probably 80% of my patient contact with people are from Canada, searching from anywhere from open heart surgery to dental to plastic to cancer treatments. So, you know, what do we specialize in? It's whatever the patient's needs are. I'm here to not advise. I'm not a doctor. I'm not a nurse anymore. I'm just here to help guide you as to where you should look. And what I always say to patients is, you know, I'm a contact, absolutely, but do your homework and do it thoroughly. Because, you know, there are places out there that are not, how can I say, quality controlled.
Sure.
They don't have somebody looking over them to make sure they're doing everything correctly. If it sounds too good to be true, probably isn't. You have to do your homework and don't believe everything you hear, and that's where I kind of fit in and just kind of share my experiences.
So you've seen this boom of medical travel or medical tourism?
I have seen it. I also have seen both sides of facilities are going directly where patients can contact them, but yet you contact them, they one, don't speak English, and two, they don't have the human touch as to what it is that you're needing. You call, you're just going to talk to somebody who speaks a foreign language and not able to help. I don't know how to share, but a lot of the medical facilitators don't have the clinical aspect of their team to understand when a patient says, I need, something, an operation that is very demanding, on a patient's health, such as open heart surgery, or, they have cancer, time is of essence. I mean, they don't understand how fast you have to move, one. Two, they don't understand how comfortable is the patient traveling. Can the patient travel 12, 15 hours abroad? No, a lot of them can't. That's why usually medical care is not an elective thing.
Sure.
It's something that is needed. And understanding that and having my experience as a nurse, when you say go, it means yesterday or now. I mean, it's not, in 2 weeks.
So, from Canada, you've helped people go all the way from Canada to Mexico to get their medical care?
Typically, I would send them to Mexico. It's the closest location. The proximity is speak English. Key issue, communication. How are you going to get treated if you don't have communication? You have to have that openness. Is it English you're looking for? Is it French you're looking for? I understand.
French. Why French?
Well, having dealt with Canadians, quite a bunch of them speak French.
I see.
And a lot of the facilitators, don't offer the human touch as to what they actually need and can talk to somebody in their own language, which I try to help facilitate that.
Okay, so this has been very interesting, and so if there is an AMAR member or AMAR website visitor, and they're interested in talking with you, how do they establish contact?
Actually, it's very simple. All they would need to do is go to the AMAR website, and there's a form on there where they would just put in their name and their email address and what they're looking to achieve or what they want to find. For their health care, dental, whatever it is that they're looking for. Just here to give them some advice. I mean, not give advice as such as medical or as a doctor, but here as just a person with many years of experience in the health field to help guide them.
Okay, great. Any closing thoughts?
Closing thoughts, do your homework. And
research.
Do your research. Don't go to whatever sounds the best. If it's too good to be true, it probably isn't. I said that once before. It's very, very real. There's great, great care in Mexico. That's why I've chosen to where I'm at now and help patients do that, but they do need to do their homework, and I'm here to help guide them in their research.
Wonderful.
That's it.
Wonderful. Well, thank you very much, Tina, for your time. And again, thank you for viewing this. AMAR, the Association of Retirement Communities in Mexico, is very interested in advocating the senior care and living industry in Mexico. And this is just one of the services that AMAR is providing to its members. Thank you and have a good day.
Thank you.